work with patients with swallowing and communication difficulties, and that can be as a result of stroke, neurological conditions, surgery, general ill health or care of the elderly. We work very closely with a great team of multidisciplinary professionals to improve the quality of lives for people after they've had a stroke, and also to work with people who have degenerative conditions to try and maintain their quality of life and their enjoyment in life for as long as possible. We've worked efficiently utilising the skills of all the members of the team to develop the service, which included more dynamic training of the nurses for swallow screens, utilising our student placements for communication screens, and as a result of these and the team's hard work, we've improved our score from an A to a B, which is the second highest in the region.
There was a patient who was on ward 9, and we were able to help to do therapy with an iPad that the family had. So we were able to use apps on that device to help with speech and communication, and it was really beneficial to this patient. And his wife was so impressed with the therapy that we could give with that particular device that she fundraised to provide us with 2 iPads that we can use with other patients, and that's really fantastic because now we can use those up-to-date apps, so the most evidence-based and most current therapy with other patients, and they wouldn't have had that normally.
The most important thing from a speech and language point of view when you've had a stroke is early nutrition, early eating food, getting food into you early on improves your stroke, improves the outcome from stroke. It has a great deal of positive impact really on patients' experience and patients' health. The quality of the service that we get from speech and language is really self-evident. You know, we have national benchmark audits, so we're compared to hospitals around the country, and the speech and language scores have been consistently among the highest scores that we have in Bradford.
It is nice to be recognised, I suppose, because you come to work and you do the job, don't you? But we are a small team with a lot of patients to see, and we have really tried to sort of hit targets and improve constantly. And so it's great that our manager has said, you know what, you're doing really well, and I'm going to try and get you recognised for that, and it does feel good, yeah.